Hi, I'm Beth Gaddis, the Vice President of Marketing at Patient Prism, and I'm delighted to welcome Christine Taxin to our studio today. Christine, it's such a pleasure to have you.
Thank you so much.
So, Christine is one of the foremost specialists in medical dental cross-code billing. You have worked and taught students at Harvard, you've taught students at NYU, and of course you travel all around the country at symposiums and giving lectures about cross-coding and billing. And tell us a little bit about some of the procedures that dentists do that can be billed to medical insurance.
Yeah. Well, temporal mandibular disorder, which is the jaw opening and closing, that's billable. Then you have sleep. You have
like sleep apnea.
Sleep apnea for adults and children.
I think that's so fascinating. I had not thought about it for children.
For children, and Botox for temporal mandibular also, which is unusual. A lot of people don't realize that Botox is not cosmetic in a lot of instances. So if it's not cosmetically used and it's used for a medical necessity, which is pain, headaches, then it's a billable procedure.
So when you're making the case to bill it to medical, what is some of the information that you need to be gathering so you can make that case that it's a medical necessity and not just cosmetic?
Well, that's a great question. Most insurance plans, the contracts read that the patient has to have a headache for 14 days.
In a row?
In a row.
Wow.
Or they have been treated by their medical provider and haven't had relief. And especially now with the closing in on drug taking, Botox is a much more acceptable procedure for pain, jaw pain, than ever before, because they don't want you to take an opioid. So let's do Botox. So if you read the contract, it's going to say that. Of course, you want to pre-authorize again and make sure that it's a covered procedure, but we have to know how to ask. That's the trick. Don't call insurance and say, is Botox covered? Call insurance and say, I have a patient who's had 14 days of headaches and the medication the doctor doesn't want on anymore, and we'd like to use Botox.
So it's telling that story again, making it medically necessary and phrasing it in a certain manner in order to get that pre-authorization approved.
Absolutely. And the other big thing with Botox is you're purchasing the Botox, so you're charging out the insurance company for the vial, the units of Botox, and the injection. And then all you need to do is write what muscles the doctor is injecting and how many units did you use. So I have doctors getting like 157, 147. You know, of course, it's according to how much Botox you're using, but it is covered.
That is fascinating. Well, I think a lot of dentists don't know that, so I really appreciate you sharing your knowledge about that today.
Thank you.
And just before I let you go, tell everybody how they can find out a little bit more about you.
Okay, well, you could go to my sites. I have two, dentalmedicalbilling.com or links to success.biz. And both of them have a wealth of knowledge where I'm speaking, or everything about me pretty much is on those two sites. Or you could just email me at ctaxin@linkstosuccess.biz.
Christine is very abundant with her knowledge, so definitely recommend that you check out her website and see if cross-code billing is something that you should be introducing to your dental practice. Thanks again for joining us today.
You're welcome. Thank you.